Hello, everybody. Welcome. So excited to have you all here. I know there's a bunch of people that are kind of filing in. We've had over 500 people register for this event, and we're super excited to connect with all of you and share all of the knuckle wisdom that I have. But while we're waiting, why don't you go ahead and share a little bit about yourselves? I see hello and howdies. We have actually a poll that we'll put up that you can share a little bit about your experiences and why you have the knuckle, and let's learn a little bit about you. Hello, Marianne from Tampa. Welcome. Michael's, a couple Michaels in the house. Marianne, Sandy, Ted, Melissa. Hello, hello, hello. Awesome. Kathy from Chicago. You know that I grew up in the suburbs of Chicago. Hello, Christy. Awesome. So the first question is, do you have a knuckle? Let's answer that bad boy. So awesome. From Ireland, Rosie, thank you for attending from Ireland. That's awesome. I've actually been to Ireland. It's one of my most amazing trips ever, and I can't wait to go back. St. Paul, Minnesota. I've been there for Badger games in Minneapolis area. All right, so it looks like 90-some% of you have knuckles, but some of you have not. So you're knuckle curious, which is awesome. And so far, looks like 80-some% of you have used your knuckle. So maybe some of you are wanting more information to help you understand how to use it before jumping in, which is completely understandable. Awesome. And I want to hear all about why you bought the knuckle, or why are you even interested in the knuckle? I want to hear what's going on in your body so that I can make sure to touch on that today. It's interesting, a high percentage of you have all of the above answer, which is very common because these three areas of the body are all connected, surprise, surprise, and they all impact each other. Only one person's looking to improve their performance. We're all like, let's just get out of pain, and let's just improve our posture, and start there, and then we'll look at performance. So tell me what kind of pain you might be experiencing. Neck pain. I don't know how many of you guys are looking down at your phones all day or on your computers, and the tech neck situation is real. That's for sure. Looks like that's a big issue for people. And shoulder pain. Absolutely. As we'll learn, the shoulder is absolutely connected to what's going on at the neck and the chest, and that can really impact what's going on there. And we've got some headaches in there. It's very common as well. Chest pain. Awesome. Well, those of you that are going to be entering, everyone who enters next will be able to see the poll. If you haven't had a chance to do the poll, please chime in. But I'm going to get started because I know all of you guys are really anxious and excited to learn a little bit more about what we have going on. So the first piece of the puzzle that I really want to make sure that everyone understands is how important this area of the body is. This I call our secondary core. And you might be wondering, why is it a core? Like, I thought your core is down here, right? But when you think about the body actually, the core of us is actually this whole entire thing, from our brain down through our spinal cord into this area of our body. Core means like the essence. It means like the most important. It means the thing that is at the root of our body, and our nervous system really is at the root of our body. So we talk about this core, right? Our hips and our abdomen and our low back a lot, right? We do core exercises for this area of our body, and that's really important. So for those of you that have the knuckle and are working on addressing this part of the body, your head and your neck, you actually also need to be thinking about this part of your body, because this is the foundation for which where everything else comes. So for example, if things are out of alignment here, where things are being pulled on, that's going to change the way that your whole entire spine is lined up, which will affect the base of your skull and which will affect your chest. So this is why I launched the hip hook first and created that tool, because this primary foundation is key. But then if you're addressing this but not addressing this, then you're missing the piece of the puzzle. Even if you have hip issues or low back issues, tension at the base of the skull affects the nervous system. Tension in the front of the chest affects the way that the whole spine aligns. So those things are very important, and both of those areas need to be addressed. So that's like the big picture, why you're here and why I'm on my soapbox about how important these two areas are. And I apologize about my psoas dangling here. This is what happens when you have a tight psoas, right? If you're not using your hip hook, it literally pulls off the bone. So over all of these years of experience, I've been a physical therapist for decades now. I've seen how important tension in the pec minor and the base of the skull are to not only pain, like you guys have mentioned, neck pain, headaches, shoulder pain, but also how the nervous system operates. It's an area of the body that I treat in everyone, and I check in everyone. Even if you came in to see me with a bunion in your toe, I would be checking your neck to make sure that that's released and happy and relaxed, because it impacts whether or not you can heal everywhere. So it's super, super important. And of course, it's directly affected, by migraines and neck pain and things that are right here, but also anything else in the body. So what I want to talk about first, so there's, as you probably have seen in the instruction manual and some of the videos, that there's three main areas that we can use the knuckle in. There's actually lots of ways you can use the knuckle, but these three areas will really affect the secondary core up here. Right? The base of the skull is the most important because it's most directly impacting your brain and your spinal cord. And it affects whether or not you can be in good posture. Secondarily is your pec minor. Pec minor is the muscle that pulls you forward and rounds your shoulders forward. And that rounding forward impacts whether or not your head can be balanced on your head, on your neck. But it also impacts the function of your shoulder, and it also creates that upper trap tightness that we all deal with, right? So the third thing is the upper trap, right? If you address this without addressing these other two areas, you're not really getting at the source. So they all kind of fit together, but they do have a sequence, and it is important to address it in those ways. So we'll start with the neck. I'm going to bring Shri in so I can show you guys a little bit about where this tool is intended to target. We're going to use his beautiful neck as a model here. So I have this little skeleton model, which shows the skull, and then it shows all these muscles that are attached to the skull up here, and then all these muscles that attach to the different vertebrae going down your neck. So you have all these bones in your neck, and then you have your skull, and at the top you have your atlas, which is the first bone, and your axis, which is the second bone. And there are lots of practitioners out there, upper cervical chiropractors and physical therapists, that focus right here at the base of the skull, because this is so important for the nervous system. It's so important for everything that goes on in the neck. And 80% of your rotation range of motion, that's like when you rotate your head side to side, comes from those two bones. So if there's tension here, that impacts so many things, right? If you go to check your blind spot, or you go, maybe you're at a concert and you're turning to the right to look at something, or at a dinner party, right? If you don't have good mobility here, it affects everything. So if I match this up to Shri's head, his skull is here, and then right about here is where this bone starts to curve in. So you can see his hairline is actually, it's like a couple inches higher than his hairline. So it's actually in here where these muscles lie. So when you're using the knuckle on these muscles at the base of the skull, you are actually working up here, which can be confusing for some people, right? Your neck actually starts way up here. And then as you see, some of these muscles are actually closer to the center, and some of them are further out from the center of the spine. So this is why it created the knuckle with these different widths. If you're using the widths that are closer together, they're going to be kind of hitting those center muscles, right? If you use the tips that are further away, like this, they're going to hit the muscles that are a little bit further away. And then similarly, if you use the wider tips, it's going to hit the muscles that are even further out. So the tips are really designed to be able to target all of those different muscles. And you can see, even as you work your way down the spine, there's muscles that are closer to the spine and muscles that are further away from the spine. You know, so on the head, you know, you've got these that are really close, these that are a little bit further, and then these that are a little bit further away to target the muscles specifically. And this is really important because if you target all these muscles at once, like using a tennis ball or racquetball or golf ball for that matter, you're going to hit more than one muscle at a time. And you may, the muscle that actually needs all of the attention might actually kind of sneak out and not be able to be pressed on. You need to be able to find something that's pinpoint enough to isolate each and every one of those muscles, which is why, you know, I designed it in the way that I did. So I guess the important thing to know here is that the skull is way up here. And then this here at the base of the skull is like the magic place where you're going to want to start. And then you can work your way down with the different tips to find what you're looking for. And so many of you might be wondering, well, okay, what is the magic spot? Like, where am I supposed to press or where am I not supposed to press? And to be honest, it really depends on you. And it's going to change for you each and every time you use the knuckle. One day you'll lie on it and it'll be the right side, really close to the spine right here. That's going to be the most tight. Then maybe the next day you use it, it's going to be the left way over using the wider tips. So my suggestion to you is that you make sure that you explore each and every time to find a couple spots, probably no more than 3 each session, that seem to be revealing themselves as the most intense spots, and then focus in on those, and it'll be different each time. So it's not like you're going to be like, oh, I figured it out. This is the one spot, and you know, that's going to change from time to time. And especially as you're peeling the layers of the onion and starting to release some of the tension, new things will present themselves, right? And that's your path to healing, basically. Okay, so now I'm going to have Shri lie down on your back. I'm going to take this out.
Christine, Beth is asking if there's any places around the neck that should be avoided completely.
No, there will be certain spots that will feel really tender to you. You know, and we'll talk about that as I'm demonstrating here, how to kind of ease into those. But there really is no spot that is dangerous or, you know, is going to hurt you in any way. Okay, so Shri, I'm going to have you scoot just a little bit this way. Yeah, perfect. Okay. So the knuckle can be used with any of these tips facing up, right? And people have questions about, well, am I supposed to have it angled this way? Am I supposed to have it angled this way? They're actually all different ways which are effective. And you have to experiment to figure out what feels good to you. It might be like intuitive that maybe this would be great because it's like working at the base of the skull and kind of curling under your skull. And sometimes it does feel really great, but sometimes it actually feels really great to have it this way. So there really is no right answer for that. It's all about your own exploration and figuring out what works best for you. Another thing that people struggle with sometimes is that the orientation of this three-dimensional object in space can be kind of awkward, especially as you're placing it behind your head. So if you're having trouble, or it's like moving around, or you're not sure it's straight, I recommend just setting it next to you like this. And then, sure, you can look to the side, you can see where it is, and then you can slide it underneath you from that position so that you can get a little bit of orientation. You can go ahead and move it. So when you first lie on the knuckle, depending on where it's placed and how high or low it is on your neck, will determine whether or not you can rest without using any of your muscles. So are you completely relaxed? Mm-hmm. Okay, so right now he's completely relaxed. He's not using any of his muscles, but the knuckle is positioned right at the base of his skull. And so if he were to move it down, let's say here, and rest back, his head is gonna go like that, right? So it's almost like balancing a golf ball on a tee. If you get it just right, then it stays where it's supposed to stay, right? And that just right magic spot is at the base of the skull. Now, as I showed you on this model, there's lots of muscles, and some of them are at the base of the skull and some of them aren't. And some of these muscles are actually more superficial layers that actually attach even up on the skull itself. So sometimes you can find really juicy trigger points way up here. And that, so you have to do that exploration. But moving it down can be really useful. And, even if you move it down a millimeter, in order for him to be able to put pressure on those muscles, you're going to have to engage some of your muscles here and kind of tuck your chin a little bit. So he's using the muscles in the front of his neck, tucking his chin in order to put that pressure on that muscle. Otherwise his head would kind of fall back, right? And he's getting a good release right now because he's getting some sinus drainage. And that was actually a question that people had. Can this improve sinus pressure? And absolutely. Even releasing the pec can actually reduce sinus pressure. So definitely, it's definitely something I've used a lot with people to release that tension. So the other thing that you may need to do to find the spot that is useful for you is rock your head side to side. So for him, like say you lie on it straight, do you feel one side more tight than the other?
Yeah.
Left. Okay, so you could put a little bit more pressure on the left to really isolate that spot, take some pressure off of the right. And that way, then you can kind of find that magic spot that you hold until it releases. And he's getting all kinds of drainage, which is awesome. So once you find that spot, it doesn't really matter which one it is. If you find a tender spot, you should be grateful and excited that you actually found something that is ready to be addressed. And then you want to make sure that you hold that pressure for 30 to 90 seconds or longer. And this is, when I say 30 to 90 seconds, I'm saying that a lot, and you've probably seen that in a lot of the videos. The reason I'm saying that is because after 30 seconds, it should start feeling better. When you first start putting pressure on something that's a muscle, that's a trigger point or muscle knot, at first, it'll feel really intense, and it'll actually increase in intensity for the first 30 seconds. After 30 seconds, that pain should get better. It should start to decrease. And if it doesn't after 30 seconds, then your body's not ready, or it's a spot that doesn't want to be pressed on, and you should stop. Okay? So then after that 30-second mark, things start to get better. They should continue to get better and better and better. That pressure should continue to decrease over time. So in that position, as you're holding that magic spot, you want to take some deep breaths. You can close your eyes. You can rest and relax, and just paying attention to whether or not that tension is decreasing. And that tension might decrease for 90 seconds. It might continue to decrease for like another couple minutes. If it's continuing to get better and better and better, you should stay on it. And then there'll be a point in time where it stops getting better. It might be, let's say it was, maybe you got 80% better, but it's still there a little bit. That's when you know you can stop. If you stop too soon, you have a higher chance of activating a trigger point, which can create, pain down your arm, which can create headaches, can create all kinds of things. So it is really important to try to hold it until it stops getting better. That makes sense. So there were some questions too about whether or not, like if the knuckle is slipping underneath, or if it gets maybe like part of it comes up off the ground. Let's say, go ahead, you're like this. It actually doesn't matter. As long as you're using it to find a spot and you can hold one spot with consistent pressure, it doesn't matter if not all four tips are on the ground. It doesn't matter, like if you're moving side to side, if one side comes up off the ground or another. Let me take this out. It can be like this, it can be like this, it can be like this, it can be like this. It actually doesn't matter, just as long as one of these tips is hitting a magic spot and you're able to hold it. So I wouldn't worry too much about that. And the rubber that's on here is intended to help it from slipping. If you're on a slippery surface, let's say maybe a slippery floor or like a sheet, it might slip. So you want to do it like, on a yoga mat or something that isn't moving around too much that way. And I think I covered the curves of the tip and why you actually would want to try it this way or this way. And I was surprised actually, because I designed it to be more like this, but then I was surprised how amazing it felt, doing it here. So we have all these muscles all along the spine at different distances away from the spine that you want to explore. And you can choose to focus on 1 to 3 muscles at each session. I wouldn't go much more than that because, you are creating a lot of healing and a lot of, irritation to that area. So you want to take it nice and slow and gentle. If you're someone who happens to have a lot of neck pain or, is in kind of more of an acute state, you may want to consider just doing one spot and giving yourself a break of a day or two in between so that your body can have a chance to heal. Sure, you can go ahead and step up. I'll need you back here in a second. Thank you. So I wanted to touch on a couple other things. Can you use it too much was one question. And again, it depends on how sensitive your body is. If you're in a state where you're really suffering from an acute irritation, your neck is really in a lot of pain, or you're having a lot of headaches, then you do want to take it slowly. When we put pressure on these muscles, we're actually trying to change the relationship of this muscle with your brain. Your brain is deciding that it wants to hold tension, that it feels unsafe, that it's trying to protect you, and that takes time. The knuckle and the hip hook, for that matter, are long-term solutions. They're getting at the root of the problem. So it does take a little bit of a journey to get you to the point where those muscles have learned how to behave in a different way. Now, if you have migraines or if you have like chronic headaches, it is very common to use the knuckle and to trigger a headache or trigger a migraine. If that happens for you, if you hit like a certain spot and you end up with a migraine, it actually is a great sign. I know you're not going to be happy with me, but it is a great sign because that means that tension in that muscle is responsible for your migraine, your headache. So think about it this way. You have found the Holy Grail. You have found like that muscle that absolutely needs your attention, and you actually have a tool that can put pressure on it. So even if you do aggravate yourself, even if you do end up with a migraine or a headache, you are actually releasing tension so that the next time you maybe are more susceptible or typically are susceptible for a headache, you won't get one. And this has been my personal experience as well. When I get migraines, I've had migraines ever since I started working as a physical therapist because of the way that I turn my head all day long. And when I use the knuckle, I can trigger a headache and have a migraine. However, when I'm not using the knuckle, my frequency of migraines has gone down to nothing, basically. So we're addressing underlying causes, and that, we're going a little bit deep into our body and into the source of the problem, which in turn has its set of, of experiences that go with that. So I want you to recognize that it's worth it and that is normal. And also a piece of the puzzle too, I know there was someone who said, well, I felt a little swollen afterwards, or I experienced it. That also is normal. We are working on muscles that aren't happy. Happy muscles don't hurt. So if you lie on the knuckle and it hurts, it means that muscle is not happy, right? So we're trying to get it happy. We're doing that through prolonged pressure, and using ice afterwards can be really useful to help you kind of calm down any irritation you create. And it's actually something that I recommend for people who do have migraines when they use the knuckle, is to use ice afterwards for 10 to 15 minutes on the neck, because that will help modulate the vasodilation, the way that your vessels expand when you do trigger point release, and will help your body to manage that. There's a whole another topic on that I can go into, but using ice will definitely help. And then if you experience any kind of spasm, oftentimes trigger points will create spasms. That's totally normal. Usually making sure that you're well hydrated, making sure that you have electrolytes, using salt, having salt in your diet, magnesium can really make a big difference there. Okay, so I think that's a good overview for the neck. And I just want to pause here and let everybody know that I'm going to be continuing to create content and information to share with you based on the information that you asked from me on our YouTube channel. So if you're not a subscriber yet to our YouTube channel, make sure that you are, so that you get notified of upcoming videos that we create. Anytime we add something new, you'll get a little notification there. All right, you guys ready to talk about the pec? So pec minor is a teeny tiny muscle that's right underneath your clavicle, and that muscle basically rounds your shoulder forward. So if you're like this, which oftentimes we are, that's your pec minor. And it's not your pec major, that big muscle that we work out when we do bench press, but it's a teeny guy, and it's the one that's responsible for pulling your shoulder forward. So I want all of you guys right now to round your shoulders forward. And then I want you to feel what that does to your upper trap muscle. Does it feel tight, or does it feel nice and loose? So then compare that to what happens if you open up your chest and you sit up nice and tall. Now feel your upper trap muscle. It should be nice and soft, or at least softer than it was when it's here. So now you can see the direct correlation to tension here and what happens in your upper trap. Similarly, let's all round forward again, and let's raise our arm over our head and see how far you can raise your arm over your head. I can go to about here, and I can feel like a pinch in my shoulder. So if you're experiencing shoulder pain, a lot of that has to do with pec minor being tight, pulling you forward. So now if you sit up nice and tall, let's see how far your range of motion is. Like, quite a bit different, and I don't feel any pinching when I do that. So with that tension, it really impacts a lot. It impacts whether or not your head can be balanced on your spine. It can impact your range of motion in your shoulder. It can impact what's going on with your upper trap. It can be the origin of headaches, because trigger points can be from your upper trap. I actually have a little trigger point chart, and you can see here where if you press here, or if this muscle gets irritated, which is the one we were just working on, it can create pain up your neck and all the way behind your eye, even your jaw. And if we look at some of these muscles, for example, at the base of the skull that we're targeting with the knuckle on the neck, you can see how those are responsible for headaches. And there's a whole bunch of these pictures of different muscles and how they cause headaches and refer to the head. And pec minor, which is what we're talking about now, can actually cause pain in the shoulder. And it can also cause pain down the arm too. And there's another little muscle called subclavius, which you can also get at with the knuckle, that can also cause pain down the arm, mainly in the thumb and the fingers. So you can see why these guys are so important, right? All right, Tree, you ready to talk about the pec?
Yep.
All right. So, are you over here, Jess? So this muscle right here is your pec minor. Here's your clavicle. So that's your collarbone. You can feel that in yourself right here. And then pec minor kind of attaches, actually attaches to your shoulder blade. This is a little bone that sticks out from the back of your shoulder blade, and then to your ribs. So it's right here. So I'm going to have you come over here. Now, when you use the knuckle for your pec, you have lots of options. You really just have to find the angle that works well for you. Either this tip or this tip. Sometimes using it here, like underneath the clavicle, can be really useful. Let's start with that. Why don't you position that underneath you? Okay, and if you can just put your arm, is that okay?
Mm-hmm.
Okay, so this is one way of having it underneath the clavicle. And he has the tips like this, so they're kind of like right underneath the collarbone. Similarly, you could take it and you could do this. So you're going more up and down on the muscle and just using a different side, and that gets at a different part of the muscle. And you can see how much easier. I know probably a lot of you that have worked with pec minor before have used a tennis ball or a racquetball. This is designed to be far enough away from the wall so that you can actually have your face up against the wall and not be squishing yourself. If you use a tennis ball, try that, Tree. It's not very easy. Can you even feel anything? So this allows you to get in there, and it's also much more pinpoint. So you're actually targeting that muscle instead of a tennis ball, which is just kind of getting a general area. So you just need to experiment for yourself. If your feet are closer to the wall, you have less pressure. But if you wanted to get a deeper release, you can move your feet further away from the wall, which will end up putting more pressure up here. Similarly, you can also do this in a doorway. If this was the doorway and his head was through the door, you can grab onto the other side of the door and pull yourself into the tool to get more pressure that way. But basically, you have lots of options of having it, different angles, maybe right underneath the clavicle. You can try different distances apart and having it parallel to the muscle. They're all options. I think that's it for pec. So for those of you, that are excited about this information and want to continue to stay in touch, I do want to also let you know before I get to the upper trap that we do have a Facebook group. It's the Untitled Club Facebook group. And so I would encourage you to connect there. We're constantly modulating that and sharing information and answering questions there as well. Okay, upper trap. So we did that little exercise where we talked about pec tightness and how pulling forward will make this muscle tight. Same with if you have tension at the base of your skull, your head gets pulled back and that causes upper trap tightness too. So both of those need to get addressed first before you start working on your upper trap. This is the muscle that almost everybody has as tightness. Someone comes up behind you and grabs your shoulders and you're like, oh, I had no idea, it was so sore. So this is extremely common in a lot of people. And, we can all, it's easy to find, right? You just go over and like touch your shoulder and you can feel it. Actually attaches here kind of in your shoulder and goes all the way up to the base of your skull. So when you are using the knuckle at the base of your skull, you actually are addressing a certain aspect of the upper trap. but trigger points tend to be kind of in this meaty area right here. So that's what we want to address. And there's other tools you can do this with. You know, there's a Theracane, and there's other things that you can do to reach back there, even trying to use a ball up against a wall. However, the problem with all of those is it's not passive. You can't really relax into it because you're actually actively using that muscle, which is why I love using the knuckle on the ground for this particular purpose. So you just need to find a place. It can be a table leg, it can be a chair leg, it can be actually a corner of a doorway. So if you imagine like this is the doorway you walk through, and this is the frame of the doorway, this is a great place to place it. And you can use all the different angles. Again, it's similar to what we've talked about with the neck and the pec, that it depends on where exactly in the muscle, you know, your particular spot is, and each of these positions will be slightly different in how they press. So you need to do your own exploration to find which side works best for you. But let's just start with this side. So she can have you lie down, your head in that hole there. So imagine Shree's head, put your head over here and your feet that way. His head is in the doorway. So we're pretending this is a doorway. This is his head in the doorway. And you can see that this would be up against the doorway. And if you move your body up towards the knuckle, it would put pressure into the knuckle. Is that a good spot?
Mm-hmm.
What are you feeling?
Tightness.
Yeah. So if you want to get more pressure on the knuckle, after you've done your exploration, maybe you try a different spot. That's a good one, isn't it? So you can do this in many ways. If you're using a table leg, or even a doorway for that matter, you can grab onto the table leg and pull it towards your body. This actually fulfills a purpose because it's activating your shoulder depressors, which are the opposite of your shoulder elevators. Therefore, you're actually helping the upper trap to relax. So I really like this because you're tricking your body into getting that muscle to relax. You can also completely rest this arm and take your opposite arm and pull your body towards the tool. Similarly, you can rest both your hands and you can do a little bridge with your butt up off the ground, which puts more pressure down onto that spot. Or go ahead and lower yourself. You can even just push back with your feet into the tool. So these are all ways to increase pressure. Similarly, with all of the things that we talked about with the neck and the pec, super important to find that spot. He's getting some drainage again. Find that spot and then hold that for 30 seconds to make sure that that's the right spot and it's going to start getting better. And then if it continues to get better after 30 seconds, stay on it until it's completely relaxed. This is another spot that will cause headaches or cause irritation if you don't hold it long enough. That's actually the biggest problem that people have, is they are not staying on the spot long enough and they're not holding it for long enough. So I really encourage you to close your eyes, breathe, and be patient when you find these magic spots. Thank you. You know, the knuckle can actually be used on lots of different spots. I focus on these three areas because they're so key to the secondary core and key to your health and wellness all over your body. But, you know, if you have, let's say, soleus tightness, where you can use that on the two sides of your Achilles to put pressure there, which is a area that'll have a lot of people have tightness. You can use it on your forearms. You know, if you had an intense workout with your forearms, you can lean up against your forearms. You can even, use it up against a wall where you're putting it up against the wall and using it for your piriformis or using it on different parts of your shoulder. And we'll be releasing more videos to show you some of those hacks. But I don't emphasize that because really, truly, if you're focusing on your primary and secondary core and releasing tension there and creating alignment there, everything else really falls into place. All those other things are symptoms, not the cause. And, it would be a disservice to you to have you kind of going on a wild goose chase per se, chasing after all the areas that were tight without first addressing the most important, the most primary. So let's see. We're going to spend a little time. We've got 20 minutes left. It's awesome for some Q&A. But before I get into Q&A, I want you guys to know that this video is being recorded, and you will get an email right after it's downloaded, which will give you access to this video so you can watch it at any time. And for those of you that are unable to make it, you'll be able to have that as well. And then with that, there's going to be a link which has a survey. And this is your opportunity to share with me any feedback that you have, any information, additional information that you didn't get, anything that I can do to help you any further. So if you share that information with that survey, after that survey, you're going to get access to a special page that we made just for this event. On that special page is going to have some other videos that I think you might really enjoy. It's also going to have the first chapter of Tight Hip Twisted Core, which is important if you guys haven't had a chance to read that. An opportunity to share your feedback through a review for the knuckle. You'll also be able to make sure that you're on the newsletter if you're not already. And there'll also be a coupon code for you to access if you are interested in any additional products. So make sure that you do that survey so that you can get all that juicy stuff at the end. All right, so let's see. What didn't I answer?
So we have a few people asking about using the knuckle for their SEM, the scalenes, and the jaw. So maybe if you want to talk a little bit about those.
Yes. So the jaw is the last link on the chain. Same with the feet. So if we're looking at, let's say, the primary core and the pelvis and how the pelvis is aligned, if there's something out of whack there, that's going to work its way eventually down to creating either foot problems in the end or jaw problems in the end. So anytime you're experiencing that, you need to think, okay, I need to trace back to what is at the core. Similar to what I was just talking about and focusing on those three areas. But it's very, very common for people to experience jaw pain because it is like the last link on the chain. Like you can't, this twist, this twist, this twist, this, and eventually the jaw is the last thing and you end up with tension there. So there's lots of different ways to address that, but with the knuckle in particular, I really enjoy using it on my side and finding those juicy spots in my masseter muscle. This feels really good actually right now. So this is really easy to access, and you could use the medium tips or the ones that are close together and just using your body weight to release that. Similar, prolonged pressure, same deal. You can get a little clever and kind of get behind this angle of your jaw by using it like this. And that I can feel is a good trigger point for sure. Oh, one thing I didn't mention that I wanted to mention, I forgot. So I'm thinking about as I'm using this. I talked about when you're using this on the neck, and this goes for the jaw too. I talked about having to activate your neck muscles a little bit in the front in order to kind of get the right angle or push maybe one side or the other. On a similar note, some people, when you first use this, whether it's on the jaw or on the neck for the first time, it can be really intense, especially if you're inflamed and that muscle has been sore for a really long time, and you may need extra support. So one way to do that is when you're on the knuckle, let's see, we'll use it this way, is to actually just take and hold your head with your hand so that you're taking some of the pressure off of the knuckle. And then as your body starts to relax and that muscle starts to release, you can let go of that pressure and let the weight of your body do that. But at first you can hold it up. Similarly, you can put a pillow under this part of your head, or actually a roll. I think a roll actually works better if you take a towel roll
and roll that up like a beach towel so it's nice and thick, and then put that at your head. That'll help take some of the pressure off there too. And then again, as your body gets used to it, you'll start feeling, okay, it's not as intense anymore. Maybe that 30 seconds has passed. Then you can let more and more of that pressure, that support out so that you can tolerate the full amount.
SCM, I think that was the other muscle that was mentioned. SCM actually benefits best by a pincer grip. So you could do direct pressure. You can, manipulate that and push directly into it that way. But I think it actually is much more effective if you can pinch it. So finding that muscle at its attachment here or a little bit below it or wherever the trigger point is, and then squeezing that is the most effective way to release tension there. What else do we got, Jess?
Is it okay to use the knuckle on the neck even after having neck surgery or fusion? Same kind of thing after any shoulder injury or shoulder surgery.
Yes, yeah, great question. So you absolutely, anytime you're putting pressure on the skin and the soft tissue, you want to make sure that those tissues are healed. Think about it this way. If you cut your finger, you're not going to use your finger, or you're not going to put pressure on that cut until the cut is healed. Like an open wound doesn't like to be rubbed on, right? So similarly, when you have some sort of surgery or some sort of intervention where the muscles have been in the tissue, in the skin, and all the fascia, has been cut and, is recovering, you want to make sure that your body has recovered fully before you start pushing on the tissue at or around that spot. Once you've passed that, which is usually 4 to 6 weeks where that's completely healed, some more major surgeries, the wounds take a little bit longer, then you can start pressing on that area. And it's actually really useful because anytime you've had any sort of intervention in your body, especially surgeries, your brain has experienced something that, is a threat, basically. And so your brain is going to create pain and is going to create muscle tension to protect you. That muscle tension is oftentimes what is at the root of why people have pain after surgeries. Like the actual thing that you went in to get repaired, maybe it was a rotator cuff, maybe, you had a fusion or, something was repaired. So theoretically, you should be out of pain, right? But why do you still experience pain? Well, oftentimes that's muscle tension. So I would, with anything, we talked about when you're in a sensitive situation, gradually increasing the use, gradually increasing the pressure. If you're working on your neck after a fusion, I would definitely use that towel roll or your hand to gently put pressure on those muscles. Maybe just pick one spot and then maybe do a little bit of ice and then come back the next day and see how you're doing, or maybe even give yourself a break in between each session. But chipping away at that muscle tension that's developed as a result of that particular intervention is going to make a huge difference. And this is oftentimes what I did a lot in the office was people would come in after having surgery. They're like, wait a second, why am I not better? And it was oftentimes muscle tension that was at the root of why they were not completely improving.
How about using the knuckle to help with vertigo?
Vertigo. So vertigo is a little bit complicated. There can be servogenic vertigo, which is a result of the neck muscles pulling on the spine and the nervous system and creating the vertigo sensation. Vertigo can also be due to the inner ear, and there's a bunch of different phenomena that can happen with the inner ear. And then also people can feel dizzy because of their orientation in space due to what happens with their brain and their cerebellum. So if you have a case of vertigo that is cervicogenic, that would benefit from the knuckle. Because, as you know, with anything, you don't want to aggravate yourself. You want to make sure that you're doing it really gently to see, how you can tolerate that, maybe even using ice to help along that process. But if it's not an inner ear thing, that you don't have BPPV or some other thing that is inner ear related, then you can absolutely use the knuckle for that. Now, having said that, I have treated a lot of people who do have inner ear issues related to vertigo, and secondarily, tension in their neck has prevented them from fully recovering. Maybe they've done the Apley's maneuver, other kinds of things to help with their inner ear, maybe some desensitization, but they're not getting all the way better because there's muscle tension in the neck. And remember, I talked about earlier, muscle tension in the neck affects the nervous system in the brain and the spinal cord. So you can see if there is tension there, how that would possibly impede upon your recovery.
Are there any recommended stretches or exercises that you think would benefit people after using the knuckle in their necks, pecs, and traps?
Great question. We're in the process of developing a course that goes through in more detail about all the different pieces of the puzzle that can help support use of the knuckle. But I'll give you a couple general tips. If your main issue is your pecs and you're working on your rounded shoulder phenomenon, you really want to strengthen the muscles in the back of your shoulder. So doing anything like a row, you can even take a TheraBand, tie it to a doorknob, and pull back in this direction, a row and lat pull down. Same thing with a band. You can do something like that, or at the gym. Bent over rows if you're using like a lightweight. Doing something like this to strengthen your rhomboids in the back of your shoulder, even letting your shoulder blade come all the way back down and all the way back up as you're doing that motion is really helpful, because we want to be strong here to help counteract what's happening here. And that will just allow you to maintain better posture as you're doing your life, which will prevent you from creating that muscle tension to begin with. And then when it comes to the neck, probably the most important thing is the deep cervical muscles. So similarly, like when we talk about the core, the primary core here, we oftentimes will do muscles, just strengthening exercises for the transverse abdominis, plank type exercises, which strengthen that deep layer of muscles, which help hold you up all day long. Similarly, we have the same thing in our neck. We call them deep cervical muscles. They're actually not your SCM, they're not your scalenes, they're deeper than that. So to do that, let's see. You're lying on your back and you lift up your neck off the ground so very slightly that you're actually not even lifting it up off the ground. Like imagine if you had a piece of paper under your head and someone needed to slide that paper out and you wanted to lift your head just enough so that paper can come up. So it's literally like no movement, but it's just a teeny bit of activation here. If you go too much, these big muscles kick in, right? So then you're going to actually feel your SCM and the muscles here at the front kick in. If you go just a teeny bit, you won't feel those in and you're activating those deeper muscles. You should be able to hold your head without activating the big ones, just enough to slide that paper out for 20 seconds. So that's how much endurance you need in those muscles. So working your way up to being able to hold that, you'll get real quivery, just like you might with a plank exercise, because these muscles are like, what the heck? I haven't, needed to be worked. But that is the key to helping your neck be more stable. And of course, you can do range of motion exercises like a chest stretch, stretching your neck side to side. But to be honest, if you're holding muscle tension in your pec or your neck, if those muscles are holding tension at rest and you try to stretch them, oftentimes that can aggravate people. So it's a good thing to do to kind of, maybe increase circulation, but without using the knuckle first, it can be aggravating for some.
And to clarify on that, people are asking if you're lifting your head or your neck or both in that exercise.
You're actually lifting your head off the ground so that someone could slide that paper out from underneath you. But you're actually not lifting your head off the ground. It's a weird thing. It's like, you're like just starting to lift your head off the ground without actually lifting it up off the ground. And you can tell whether or not you're doing it right by putting your hand on the front of your neck, because if you feel any of these muscles contracting, you're doing too much.
Alrighty, and how about using the knuckle to help loosen up scar tissue, adhesions, fascia from old injuries.
Yeah. So that is so much fun. It feels amazing. You can absolutely do that. You would need to use this as like a pin and stretch technique. So if you're doing it on the neck, you would be holding that particular position and then be moving your, putting pressure here and then moving your head through range of motion. If you're doing it with your pec, and this is a lot of people actually have scar tissue in through their pecs. People have had pec injuries. There's a lot that goes on here. Even like breast issues, maybe you've had breast surgery, like there can be definitely like a lot of scar tissue there. So if you're up against the wall, using this, you can move your arm through a range of motion and do internal and external rotation like this while you're putting that pressure. And that can definitely get at some of that scar tissue. Similarly with the upper trap, as you have pressure on the upper trap, you can slide your arm up and down against the ground, kind of like a snow angel type motion. That will help to kind of release fascia restrictions in the upper trap. Awesome. I think we're good. And there's no more questions?
We answered the most important ones. I think everyone can reach out to Hello to leave the support if we didn't get to anything.
Yes. Yes. So as you continue to embark on your journey with this new and exciting tool, I want you all to know that we're here for you. I'm constantly creating information and content to support all the questions that you might have. So please reach out to hello@alethasupport.com with anything that you need from us. If you have any concerns, we're absolutely happy to help. And thank you so much for attending today and being one of like the pioneers in trying the knuckle and experiencing the benefits that it really has to give. Thank you. Bye.